Hi guys, we are from Group 2 and for today's lesson, we are going to talk about Atenol. So, let's get started.
Do you know what is Atenol? Well, let's look at the introduction. This medicine acts by blocking the action of chemicals, which is hormones, on the heart and the blood vessel. It is also known as beta blockers. It affects the heart rate and the heart's workload. Atenol consists of active and inactive ingredients. The only active ingredient in the Atenol is atenolol, and the inactive ingredients include lactose monohydrate, stearic acid, magnesium stearate, microcrystalline cellulose, and many more.
Now, let's start with history and development of Atenol. In 1958, Sir James Black, a Scottish pharmacologist, developed the use of beta blockers for the management of angina pectoris. So, what is angina pectoris? Angina pectoris, known as medical term for chest pain or discomfort due to the coronary heart disease, when muscle doesn't get enough blood. This happens when the heart arteries is narrowed or blocked. In 1960, beta blockers become popular in clinical use, and it is also investigated for use in myocardial infarction, heart attack, arrhythmia where electrical activity of the heart is irregular, and hypertension, which is the heart blood pressure. In 1970 until 1980, after that, they continued to be investigated for use in heart failure throughout 1970 until 1980. Then, Atenol itself developed and received FDA approval in 1981. Atenol is used as cardioselective beta blocker.
A drug's therapeutic effect is the desired effect for treating a disease. Atenolol contains the active ingredient atenolol. Let's look at the structure of atenolol. Atenolol belongs to a class of drugs known as beta blockers. It works by blocking the action of certain natural chemicals in our body, such as epinephrine on the heart and blood vessels. Atenolol decreases cardiac output, inhibits renin release from the kidneys, and reduces the activity of the sympathetic nervous system. Atenolol is often used in combination with other medication, such as diuretics, to control blood pressure. Next, let's take a look on the indication and usage of the drugs. Atenolol tablets are indicated for the treatment of hypertension, angina, as well as acute myocardial infarction. Atenolol tablets can be used to lower high blood pressure, which is also known as hypertension. Lowering blood pressure will reduce the risk of cardiovascular death, strokes, and coronary heart disease. In addition, atenolol is important to prevent angina. Angina is a pain or uncomfortable feeling in the chest. Atenolol may increase the number and duration of angina attacks in patients with premenstrual angina. If you have this condition, be cautious while taking atenolol. Report unusual chest pain to your doctor as soon as possible. acute myocardial infarction is also known as heart attack. A heart attack occurs when one of the heart's coronary arteries is blocked suddenly or has extremely slow blood flow. Atenolol tablets are indicated in the management of hemodynamically stable patients with definite or suspected acute myocardial infarction to reduce cardiovascular mortality.
Now let's look at the SAR or structure-activity relationship. Let's start with the general structure of beta blockers. The most essential group in the beta blockers is aromatic ring and beta-atenylamine. Para-substituent is the highest cardioselectivity for the aromatic ring, and the aryl group affects the absorption, excretion, and metabolism of beta blockers. X can be directly linked to the aromatic ring, and the R group can only be a secondary substitution. The alkyl substituent on the alpha, beta, and gamma carbon might lower the beta blockade if the X is the oxymethylene bridge. Now we can focus on the SAR of atenolol. Atenolol consists of aromatic ring, oxymethylene bridge, propan-2-ol, and isopropylamine. The aromatic ring must be para-substituted for the maximum cardioselectivity. Alcohol group is essential as it helps in the hydrogen bonding. It is because the beta blocker's binding is based on hydrogen bonds between the beta blocker and the receptors. It is not based on the covalent bonds. Oxymethylene bridge link the beta-atenylamine and the aromatic ring. It provides beta-blocking agents, which is essential for its activity. For the isopropylamine, the amino nitrogen must be secondary as it will give the optimum activity for the ionic bonding. The branch and bulky group, which is isopropyl on the amino group, provides nucleophilicity. It helps in the interaction with hydrophobic packet located in the binding site. Hence, more bulky, more interactions, then more reactivity.
Pharmacokinetics refers to the movement of drugs through the body. It can be categorized to 4 elements. Oral atenolol absorbed from gastrointestinal tract, and only 50 to 60% of atenolol dose is absorbed in our body. Atenolol distributed into most tissues and fluids except the brain and CSF, and about 5 to 15% is protein bound. Peak blood levels are reached between 2 to 4 hours after injections. Atenolol undergoes little or no metabolism by the liver. It also undergoes renal excretions. 50% of oral dose compared to 85% of intravenous dose is excreted through urine in 24 hours. The half-life of oral atenolol is 6 to 7 hours. Following intravenous administration, peak plasma levels are reached within 5 minutes. Declines from peak levels are rapid during the first 7 hours. Plasma levels decay with a half-life similar to that of orally administered drug. The half-life of atenolol increases as renal function decreases. Therefore, for renal malfunction patients, less dose of atenolol should be taken. Now, we're going to talk about pharmacodynamics, which refers to the body's biological response to drugs. Atenolol acts as antihypertensive actions. It reduces blood pressure by decreasing cardiac output and sympathetic outflow from the central nervous system and by suppressing renin release. Anti-agenal actions. Atenolol also treating chronic stable angina by decreasing myocardial contractility and heart rate and reducing oxygen consumptions. Lastly, cardioprotective actions. It improves survival in patients with unknown heart attacks. It also reduces chest pain and enzyme elevations.
Just like other medicine, Atenol would have some common side effects. One of the common side effects would be gaining weight. Why does this happen? This is because beta blockers slow down our metabolism. Also, if you switch from taking a water pill to a beta blocker as a treatment for high blood pressure, you may gain a few pounds of weight that the diuretic kept off. The average weight gain is about 2.6 pounds. However, if the sudden weight gain reaches more than 2.6 pounds, this may mean that the fluid is building up in your legs, abdomen or chest, which may signal that your heart failure is worsening. The other common side effects would be feeling tired. Since beta blockers function to lower our heart rate, the amount of blood that the heart is pumping forward may also drop. This creates symptoms of fatigue, drowsiness that leads to feeling tired. You may also experience cold hands or feet when taking Atenol. This is because atenolol reduces blood pressure, so you might not get as much blood that contains heat to your hands or feet. Therefore, causes them to feel much colder than the rest of the body. This medicine may also affect our ability to drive or use machines. It might cause you feel sick, dizzy or tired, or give you a headache. So, visit your doctor or pharmacist immediately if you experience any side effects after taking this medicine.
Now, let's continue with the precaution before you begin using this medication. Before you start using a medication, be sure to inform your doctor of any medical condition or allergies you may have. Any medication you are taking, whether you are pregnant or breastfeeding or any other fact about your condition, because the factors may affect how you should use this medication. Here are 5 of the precautions for Atenol. Precaution 1. Breathing condition. People who have breathing problem or chronic lung disease should avoid taking a beta blocker such as Atenol because it can cause a breathing difficulty. Low doses of Atenol may be taken with caution and doctor advices. Precaution 2. History of heart failure. Beta blockers such as Atenol can worsen existing heart failure. It is important to take this medication exactly as prescribed by your doctor to decrease the chance of this happening. Discuss with your doctor how this medication may affect your health condition. Precaution 3. Kidney disease. The kidneys are partially responsible for removing this medication from your body. Kidney disease or reduced kidney function may cause this medication to build up in the body and causing side effect. Special monitoring is needed for you to consume this medication. Precaution 4. Low blood sugar. The signs of blood sugar may not be as noticeable when taking Atenol. If you have diabetes or take insulin or other medication that affect insulin level in the blood, discuss with your doctor how this medication may affect your health condition. Precaution 5. Stopping usage. Atenol should not be stopped suddenly. There have been reports of severe worsening of heart attack occurring in people with angina pectoris who have done this. It should be done gradually under supervision of your doctor. That's all from us from Group 2. Thank you for watching.